This week on Behind the Numbers, we are joined by Inder Singh, a philanthropist and entrepreneur who has dedicated his life's work to combating infectious diseases. Inder is both founder and CEO of Kinsa, a company that has partnered with Lysol to provide a free national health program titled Fluency that caters to schools all around the United States and is now rolling out in Canada. This data-driven program takes the guesswork out of caring for sick kids and allows for real-time detection of symptoms and illnesses, allowing for earlier responses at both the individual and community level. I know we all want to find a safe way to get our kids back in school after seeing the effect that lockdowns had on the mental health and education of many, and by promoting and partnering with Kinsa and Lysol, we have the ability to do just that. This is an episode you're going to want to listen to, enjoy, and please reach out on how you can get Kinsa at your schools. Hi, welcome. I'm so excited to have you on the show.
Thank you for having me. I appreciate it.
So first I want to start off on you. So if you Google or Wikipedia you can see that you're a philanthropist. You have 5 post-secondary degrees ranging from like Michigan to Harvard to MIT. And a sort of side fun fact, actually, you founded the dance marathon at Michigan University. But my cousin, actually, she went to Indiana and she participated in the dance marathon. So when I found out that connection, I got so excited. I messaged her. I was like, do you know this guy?
What a great program. The students do such wonderful work raising funds for children at Michigan, children undergoing physical rehabilitation. And it's set me on my path to where I am today. And so I'm grateful for that experience.
And so is that where the philanthropy started with the dance marathon, or was there something prior to your undergrad that sort of nurtured and evolved into this?
Yeah, it really started there. The entrepreneurial bug bit me. I started that organization at Michigan, and I'll never forget the look on the faces of the children and the families that we affected. And it was just an amazing feeling. And I said, how do I do that again? How do I sustain that feeling? And for better, for worse, sometimes for worse, I spent the next couple decades of my life working on issues related to child health. Ultimately, most of the issues I work on are related to infectious disease and how do we prevent children from getting sick and dying and spreading infectious disease. And so it all started back at the University of Michigan. And again, I'm grateful. It was a life-changing experience.
So we're going to be talking more about Kinsa and the Fluency program, but before we move on to that, I want to boast a little bit more about what you've done. So you worked with the Clinton Foundation, the Clinton Health Access Initiative, and you spent time with them fighting so many infectious diseases around the developing world especially. So you've actually been credited with saving over $1 billion in drug costs for these developing nations for subsidizing costs of malaria and HIV and AIDS drugs. And over 30 million patients have benefited from this. So that's quite a lot of smiles that I think you've succeeded on getting, and so many people that you've managed to help through all of your work.
Thank you.
And you're continuing to do that with Kinsa, which you're CEO and founder of. So I'm wondering how that idea came to be and how you came up with this project.
That was a dream job. Like, I ran around the world and brokered deals between a consortium of 70 countries and pharmaceutical companies, and trying to improve access to medicines for HIV, TB, and malaria, and particularly for children. And what a cool, amazing job. So you were using business skill and technology skills to improve access. But by the time I ended my tenure there, I was the wonderful pleasure of being their executive vice president for global access programs. By the time I ended my tenure there, I had kind of become very frustrated with the world. I realized along the way that no matter how much you drop prices of drugs, no matter how much you improve the last mile delivery of services, there was still a little bit of a ceiling. And the sad fact is that the way the world works, the way the US government, the UK government, the World Health Organization, the Gates Foundation, the way they work in trying to curb infectious disease is with zero information about where and when disease is starting. So let me pose this in a slightly different way. I'll pose the question I posed 9 years ago when I started Kinsa. How do you stop the next outbreak before it becomes an epidemic, or God forbid, a pandemic, if you don't know where and when it's starting? And the answer is, as we've all experienced in this last year, you don't stop it. So the idea was, could we identify ways to detect outbreaks in real time? Could we identify ways to confirm that they were anomalous, that they were rapidly spreading, that they were more severe, that they were going to affect large percentage of the populations, and could you forecast and monitor that? And so what we did 9 years ago was we set out to use basic technology to do that, and today we can. So we invented, you can't see it if you're just listening to the podcast, we invented the smart thermometer. It sounds very simple, and it is. So what we basically are trying to do was find a way to communicate with people from the first sign or symptom. So how do you communicate with mildly symptomatic people, and how do you learn more about what is affecting them? So today we've got this network in the United States of 2.5 million households that use our product, 5% of U.S. elementary schools that use this connected thermometer and medical guidance system. And through that, we get those data sets that allow us to identify outbreaks and predict them. And we turn around and use those data sets and we push them back to the schools and push them back to the users to help them respond. So to complicate this for just a moment, like we're able to do things in terms of data acquisition that others have not been able to do. So for example, we can talk to mildly symptomatic people. The healthcare system never speaks to mildly symptomatic people because they don't get sick enough to see the doctor get a test. Second, we see intra-family transmission patterns. We see intra-school transmission patterns, right? So how fast an illness is spreading is highly predictive of whether it's going to affect a large portion of the population. And so as far as we know, these are the only real-time transmission data sets at those nodes of disease transmission, right? The places they spread in the household and the school that has ever been seen at scale. So this is like perhaps the most powerful data set we have. And third, we talk to households that tend to get sick and spread sickness inadvertently. There's this theory in epidemiology called network theory, which says that the more people a household interacts with, the more likely they are to get sick or spread sickness, right? It's very intuitive. You interact with more people, you're more likely to get sick and spread it. So what we wanted to do was talk to those households, larger households with children, multi-generational households, multi-family households, and households that have grocery store workers or retail workers who interact with hundreds of strangers a day. Those communities are underinsured, underserved, and diverse. And they don't necessarily have access to healthcare. So we've been giving away thermometers through underserved school communities to reach them. And what we've turned around and done is now, because we're operating in those school communities, been able to help the schools and those families respond, curb transmission, prevent getting sick in the first place. And so that's how this all fits together. I hope that complexity was kind of boiled down to simplicity for a moment there.
No, that was fantastic. And I have so many thoughts, like 1,000,001 that came from all of that because there's so many great things that you're touching on in there.
Please.
First, I want to start with, you mentioned that we can't actually see who's getting these diseases and it takes so long. I mean, I'm not positive how it is in the States, but contact tracing here takes weeks at a time. And using your smart thermometer, I mean, you're not only getting the you're not only measuring temperature at that time, but you can also plug in what symptoms you have. And I love that one of the great things is then you can see, okay, I have this temperature, I have these symptoms, and it actually gives you a guide on how you can treat this at home, or based on the AI technology, should I call a doctor, which you can access through the app? Should I go see my family doctor? Or is it something urgent enough that I need to go to the emergency department? Which is so fantastic because like that day, right then and there in real time, you're finding out exactly what's going on. You can also see what's going on in your school. It doesn't take a few weeks to sort of have things disperse even more and then see, oh, actually we had an outbreak happen 3 weeks ago. Let's call every single person that you've been in contact with since then. And it just ends up being so complicated. And a second thing about how you mentioned detecting things early, specifically for COVID, I mean, last March in 2020, right when it was sort of starting in the North Americas, I saw an article that actually mentioned that you had seen through the app that there was this huge spike in sicknesses, and they weren't necessarily the flu. Like it was way past what was the normal flu amount or the normal respiratory disease amount. And you were speaking to the FDA and you were like, okay, there's something going on here. Coronavirus must be here. And I believe it was in Texas, and Florida.
New York, throughout the Northeast, Michigan, Texas, Santa Clara County in California, King County in Washington. So At that particular point in time, there were cases in King County and Santa Clara County, but there was no cases anywhere else. And when we looked at our data, we were astounded to see this unusual level of illness in many spots of the country.
Yeah, and then the most interesting part that I found about that was that the FDA actually tried to tell you, no, your results aren't credible. This isn't COVID. You're wrong. And 2 weeks later, they find out that these COVID cases are actually confirmed and it has spread. And can you imagine having known that 18 days earlier, rather than when they finally confirmed it, those 18 days, how much spread was happening? Like, who knows where we could have been if everyone would have been able to know in real time what's going on. And I think that's also a fantastic part, touching back on lower socioeconomic neighborhoods where these infections seem to be happening at a much higher rate, just because of, again, as you mentioned, multi-generational homes with many people in them. And most often these areas tend to be essential workers who don't necessarily have, I mean, in Ontario at least, our government's not really giving paid sick leave to these essential workers. I think just a week or two ago, it was implemented that they might get 3 days. But if you're having to choose between going to work with a stuffy nose but providing for your family, like if it's food for your kids that's on the line, you're going to go to work with that stuffy nose. And it just makes it so difficult of how do you mitigate this, how you manage it, how do you try and lessen that burden, and being able to know exactly what the risks are on the day of, or knowing, oh, I have a cough, but there seems to be an outbreak of something that's not COVID related, or it might be COVID related, or no one else is actually sick at school. It's just my kid. Okay, let's take a day off. He can stay at home, rest up. Like, this is such important information to have at your fingertips.
Yeah, that's exactly right.
Sorry, I ramble a bit when I get excited about stuff.
No, Gabrielle, it's really important. I think your point of, like, let's focus on that one point of, like, if you are a member of that community and you have to make a decision that day, right? Your child has the sniffles, your child has a cough. You're making a decision that day. Do I stay home with them? Do I take them to the doctor? Do I go to the work? Right? You're making that decision. What we try to do is ease that decision by not only giving you the basic medical guidance information in the app itself. Hey, what you have is not severe. You could stay home. We also add a layer of context on it, which is, hey, this is what's going on at your child's school, or hey, this is what's going on in your local area. We are seeing a rise in cases that look like strep throat, or people volunteered that information. So it's kind of this combination of, like, real dirty data science, deep data science, and, like, here's what we're seeing, as well as crowdsourcing information, as well as triage that gives you the context to say, you know what, there are 2 cases of severe illness spreading in my child's grade. You know what, this is the day I need to stay home. As opposed to, because kids get sick so often, right? And so for essential workers, that is a difficult decision to make. Do I pop them with Tylenol and send them to school, or do I go to work, right? It's a very difficult decision. You're not supposed to do that, incidentally, but that's what people do. That's the practical reality of it. And so the product itself is not just that guidance system, it's that context. It's the local context that helps you make those decisions. And that's why this program, when we give it away through school communities, is so powerful for the households that are associated with that school. And if you participate, you get that data of, like, hey, I need to aggregate anonymized data about what's going on in my child's grade or school. But the nurse does too, if you have a school nurse. I know in Canada there's not as many school nurses. Here in the United States, the school nurse gets that data. Here in the United States, the principal gets that data. The teachers get that data. Now you have a whole community response system, right? Which is, the household gets to respond appropriately with context, but so do the school leaders. And in the context of COVID-19, in the context of this fall's illness, when we're going to have both COVID variants and flu spreading and limited vaccination on children, you now need to make those very difficult decisions of, do I do hybrid learning? Do I shut down the school? Do I massively increase spend on disinfecting? And the school leaders can take action at the same time the parents can take action. You have a community response. When we've run this in the United States in 4,000 schools over the last 6 years, what we saw was a decreased level of overall illness, a decreased level of illness-based absenteeism in normal flu years, and we believe this is essential infrastructure going forward for health. The less sickness there is in the school, the less sickness there is in the community. Why? Because the school is often, not always, but often the primary node of disease transmission for the community. So that's the key point about why we operate in schools. Anyway.
Yeah, exactly. And that's been a big difficulty here, especially, I think a lot of schools in the States are open now, but in Ontario, we're still fully shut down. We've been shut down for the majority of the past year. Schools are still closed, and we're seeing the effects that it's having on kids because they're not getting any of their regular socialization. Just they're sort of cooped up at home, not able to release that energy. There's a hospital not far from us, a few hours away, and it's a children's hospital, and they've reported like enormous spikes in child suicide, child mental illnesses, anxiety, depression, substance use, and it's devastating, and it's causing a lot of pushback in terms of how can we get schools open, but also how can we do it in a safe manner, because those with kids, they're wondering, how can I know that my kid's safe at school? I don't know who he's running around with, what he's touching, what he's doing, and to have this way of monitoring in real time is such a comfort and a safety factor to know every single day you're checking in, you know exactly what's going on in the school, you know what outbreaks, if they're happening, when they're happening in like we said before, in real time. And I think that's going to be something that's so greatly received here because people want their kids back in school, but they want it done in a way that's not going to cause another wave, especially as we wait for vaccinations and we wait to see how the variants are going to react to the vaccinations and whatnot. Like, it's just going to give that extra peace of mind, and especially the feedback that you get on how to treat whatever your child has symptoms for or whatever their temperature is. And I think it's so incredible, again, in terms, it's not that expensive. They're $25 and $40 depending on which one you get. And the sponsorship with Lysol is incredible. I think it was 40% of people didn't have thermometers at home. But if you get part of this program, Lysol's sponsoring the schools, and you're getting the thermometers for free. You're getting access to all this knowledge for free. And I think this is something that everyone sort of should get on board on. I can't see any con of it.
Yeah, so absolutely. So we're very, very grateful to Lysol. Who has been a sponsor of the program. So because Lysol pays for it, it's free for the school, it's free for the families, and the families get a thermometer in the home, the school gets the software, the school leaders can tap into it, the parents can tap into it. Through their health, through their school health program, they've been sponsoring this program in the United States for many years, and they're a very long-term partner of ours. They're the ones that really prompted us to say we need to go to Canada, and we need to go to Canada now. We were scrambling to get to Canada. Yeah, it was really them. They pushed us on this, and they pushed us in the right way. They were doing this for the right reasons, and they said we need to go to Canada. And I said it's the middle of the pandemic. We don't have all of our regulatory approvals, set, and we launched. We launched in 100 schools last year. It was not the prettiest launch, but we did it, and we delivered the program. This coming fall, we're going to be in 250 schools. And so you can apply for that program. Gabriele, I will allow you to give the URL link because I don't have it in front of me, but you can apply for that program and the school gets it entirely for free. We'd love to work with the government. We'd love to work in concert with the government. We were very fortunate to work in concert with certain states and cities here in the United States where they're now starting to support this program. It's not just a corporate sponsor, it's also states and governments because they're seeing such a huge impact from the ability to detect disease and the ability for school communities to curb transmission and curb illness levels. And that's what we want to deliver to Canada. We think it's really, really important. And again, I think we're really excited that we have a corporate sponsor like Lysol who's as forward thinking about this, and that's why we entered Canada, and we're really excited to expand.
Yes, thank you, Lysol. And exactly, you've been so successful in the States, and then coming into Canada already, 100 schools participating, 250 more coming up in the fall. How are schools able to join this program or apply to participate, or parents? I know at the individual level, you can get a thermometer, a little plug to us. We have a discount code numbers15 for 15% off your order. But then in terms of getting everyone on board, how do you go about that? How do you sort of put your school in the mix, put your district in the mix?
Yeah, the key point here is we need a champion at the school. This champion at the school to kind of distribute some pamphlets that we provide the school, to make sure that people are aware of the program, that they can get the free thermometer, and then they download an app and it registers that they want a free thermometer and the school gives them one. And so it's really that simple. But the key point here is the schools have to opt in. Everything is opt-in, right? It's fully 100% privacy protected. And we only do it as a volunteer program. We don't do it as kind of a required program. In the context of COVID, there's all these apps out there that are required. So we don't allow for it to be used that way. It's part of our positioning against privacy and requirements. So we would hope that, Ontario would be interested in supporting the program, and we'd be delighted to talk with them about how to expand it beyond the 250 schools that we're rolling out in Canada.
Oh, for sure. I feel like this is a program that should be everywhere. I mean, where I am, I'm in Ottawa, and we have 4 hospitals in our city. So as you can imagine, there's a lot of essential workers. There's lots of doctors, there's lots of nurses, and all the admin staff and everyone else who works who have to be at work. And so again, there is this push of how do we get our kids safely in school, safely participating in programs again. And I think like the amount of people who have come behind this movement or this strategy and attempting to address this issue, I think everyone would love to hopefully participate. And I'm excited personally to try and push this further in the community and get this up and running. Because I have 2 nephews who are doing all their schooling at home, and you just see how it's affecting everyone just being cooped up, and they're not seeing their friends, they're not getting out there, which for good reason, but as well, how can we try and bring a little more normalcy back? So I'm really excited personally to spread the word out. And a quick question for you. So of course the thermometer, you can get your temperature with it, no problem. But then for the apps or for the symptoms on the app, I imagine you need a smartphone, or is there a way that you can access this information through a proxy, through your school, or a different way to be able to see the information if you happen to not have a smartphone? I know many people do, but...
Yeah, so there's 2 things that we've built out. So first, you do need a smartphone to use the application. To use the thermometer, you don't. You can use the thermometer as a standalone product, but to get all the medical guidance value out of it and the context, you do need a smartphone. We're encouraged in terms of smartphone. Smartphones are one of the few things that are widely across all income bands. There's a huge study from like 2017 or 2018 that showed that, at least in the US, 80% plus of all of the different segments had smartphones. So you don't need broadband access. You just need your smartphone with your normal data cellular access, simple, easy application. If you want to see the data itself, like just contextual data about what's going around, we're not yet there in Canada. We don't have enough yet thermometers out there, but there's this website in the US called healthweather.us, which shows you your risk level on a county by county basis, and in certain places sub-county down to the zip code level. What's your risk level of contracting an illness? And our goal over the next year is to set up healthweather.ca for Canada, so that you'll be able to see that same information. Even if you don't have a smartphone, any web browser, you could go see it. In order to get the kind of insights that we need to set that up, we have to deploy the program, of course, beyond that. I also just wanted to make a plug for applying. If your school is interested in applying, you can go to kinsahealth.com/Kinsa-for-schools. So Kinsa for schools. So kinsahealth.com/Kinsa for schools, and you can apply for the program on behalf of your school, and hopefully you'll get it this fall.
And don't worry if you don't have a pen on you, we will link all of that in the show notes. So just go there wherever listening, Spotify, Apple, it'll all be there. But before I forget, I wanted to just address this last summer when the pandemic was starting, I got the opportunity to hear from many public officials how they were responding to COVID, how it's going, how it's affecting different areas. And something that I came across while looking back at the response from SARS is that there seemed to be this moment of heavy intervention. We see the importance of public health. We see the importance of mitigating infectious diseases and really combating them. But as time goes by, there's a lull. And it's sort of forgotten and in the background until the next wave hits. And something that I was so excited about when learning about this project and reading about it, I mean, you guys were way ahead of the game. You weren't starting it because of COVID. It had, like, you started about a decade ago. And I think that's so amazing that you just kept pursuing this topic and you knew how important it was and you weren't letting it go, as often happens, unfortunately, in public health, that it's when there's nothing bad going on, you don't pay attention to it. And so I think it's so great that it's just been something that you've continued to work on and build, and it's been so successful in the States, and it's entering Canada and rolling out, and I believe you're planning on moving to like the UK and Europe and really expanding across the globe.
Yeah, we're really excited to take this to the next step. Thank you for the kind words. We've been working on it for a while, and I have to say, as an entrepreneur, it was really there was excitement at the beginning of the pandemic. Like, okay, we can help, right? And we were getting a lot of publicity. I have to say that in hindsight, as a public health person, I was frustrated because we need to use these kinds of modern data techniques to actually respond. And I think that our public health infrastructure across Canada and the United States has been woefully underfunded. They weren't sure how to use data like this. They weren't aware of data like this. And like, these are the kinds of things that we need to support our local public health officials to, like, get them the funding they need so they can start scaling up. These sound like one-time events. North America was largely spared by 2009 swine flu and 2003 SARS. They occurred, but we were largely spared by them. The Asia Pacific countries were not. They've experienced 3 pandemics over the last 20 years. They were ready during that first wave, right? Many of them had a lot of success in avoiding COVID during that first wave. We need to be ready for the next one. We need to be ready for seasonal flu. Just as a reminder, in 2017, 2018, that was a couple years ago, that was the worst flu season on record. In the United States, 80,000 Americans died from that, right? We need to be ready because epidemic threats are only increasing in their frequency and severity due to issues as wide-ranging as population growth and climate change. And so we need to be ready for the next one. We need to be ready for seasonal illness. We need to help those populations that are vulnerable every year. And with COVID variants and COVID continuing on in a seasonal capacity, I am worried about this fall. And so I'm hoping that we can be out there to help.
Yeah, and that's something I actually want to mention. I know we spent most of the podcast really fixating on COVID because that's so prevalent right now. But I just want to further enforce the fact that even when hopefully we are able to move past COVID, and hopefully as the vaccines are effective and we're able to return to some normalcy, the product isn't going to stop being useful when COVID's done. Like, you can't deny that the flu comes every single year. You can't deny that kids get sick all the time. And I think that's so amazing with this product is that its utility is truly indefinite. We'll be able to use it long after any sort of pandemic arrives or goes, like every year, constantly, every season. It's going to be so amazing to have that data and have the tools and the information at your fingertips on a daily basis in real time.
That's the hope. That's what we've been doing for pre-COVID, and we hope to continue to institutionalize this in the future.
And just one last concluding remark. I just want to say thank you so much for just founding this company and for spearheading this entire program. I know in terms of the general public, we're not the ones who are making the policies, so you can start feeling very helpless. And I think it's such a great opportunity for us to, although we can't change the policies, that we ourselves can make a change. We can bring these programs to our schools. We can get these thermometers even on our own. We can just spread the word about it and get this happening from our side rather than from the politician side. Like, we have a voice. We have the ability to make these actions come forth and really help everyone around us.
Thank you so much, Gabriele. I'd love to add a point on that you just sort of mentioned, which is, if you want to change anything in the world, you need a group of people who are coordinating and collaborating. And that's essentially what we built. It's this network of 2.5 million households who have the same information who are responding, whatever problem it is. And so, I think this is an opportunity for us to, put the public back in public health, if you will, and to have this bottoms-up network where we can feel more empowered. And so I'm really happy that you pointed that out, and that's the goal. So thank you so much for taking notice of the work and for having me on. I really appreciate it.
Absolutely. And thank you so much for being willing to come on and speak about it. I'm so excited about it. I'm so excited for this episode to release and for everyone to hear about it. And it's just truly incredible work that you guys are doing. So thank you so much. Thank you so much for listening. I think the importance of this episode really speaks for itself. If you would like to reach out and be either a school champion, or if you want to just get more information to provide to your schools or your district, please reach out to us at Behind the Numbers with no E in numbers. You can find us on Twitter or Instagram. As well, you can find Kinsa at Kinsa on Twitter or at Kinsa_health on Instagram. And Kinsa is spelled Kinsa. We will be linking all of those websites as well as the one for the Fluency program itself on our show notes. So please just take a look down there for any further information. Thank you so much for listening.